Welcome to the PharmaSource podcast, recorded on stage at CDMO Live Europe 2026 in Rotterdam. This episode is sponsored by PharmaBlock, a fully integrated CRDMO providing research, development and manufacturing services from early discovery to commercial production. When Polpharma closed its Warsaw site, they had to transfer over 20 products to 5 different CDMOs simultaneously. And Andrzej Hoczyk is here with some of the Polpharma team, and he's going to walk us through exactly how they did it. So please welcome Andrzej to the stage.
Thanks, Luke, for the invitation and the opportunity to share the story here. I would say the journey, I have to say the journey of my life, and one of the biggest challenges I encountered during my professional life. So my name is Andrzej Hoczyk, external supply operation head in Polpharma. I think last week it was the 21st anniversary for me in Polpharma, working there, 15 years in industrial operation and already 6 years in procurement with ISO. One highlight here, very important, you can hear me, you can see me, but it's not only me obviously doing that thing. Doing that initiative. My precious part of the team is here with you, so later on you can not only discuss with me, but with the team here who was actually doing that transfer. Okay, so to set the things up, okay. So what was the challenge? So we were closing the site with the hard deadline. Okay, so there was a date to close the site, and obviously as a responsible supplier, as a responsible manufacturer, we didn't want to let down our patients, so we want to have the supply in a continuous way, right? So this was not the project about the optimization of the portfolio, it was not the project about the how to make things cheaper, strictly transition from in-house to outsourcing transfer of the proprietary products outside. How, let's say, it's 15 minutes for a quite extensive work, and the way I would like to guide you through it. So why I think this was quite unique project, let's say, for us. What was the complexity and the key hurdles? Why we believe that the simple project approach or the series of the project was not the best fit for this initiative. The key elements that actually, let's say, we could make it through. Then I will share openly what actually worked well and what we could have done better. This kind of lessons learned, and obviously a few takeaways in the end for you to take it with you home and to your organization probably. Some key stats, okay? The scope, as you can see, there's a point, okay. We were moving products from Poland. We were moving to 4 countries, Italy, Greece, Croatia, and Romania. 3 of them quite popular vacation spots for Polish people, especially Croatia. But that probably was not the only way that we were finding CDMOs there. In Romania, if you are reading newspapers lately, Polpharma is trying to acquire the company in Romania, so it would be our second home also soon. So we were transferring total 21 products to 5 partner sites in these 4 countries, 2 market channels. So we were moving on not only the products for our B2C markets, but also the product we are out licensing, so in our B2B platform. Mostly it was ophthalmologic sterile products in 3 different bottle systems. 1 product sterile in vials, and 3 regulatory bodies were approving our changes. A bit more statistics, okay? So we started in 2019 with extensive first request for quotations. And I would say that initial period was very optimistic because everyone was saying we can do the job, we can adjust to your technology, prices were fine, tech transfer costs were really looking great on paper. But then obviously we have performed very deep due diligence, technical and technological due diligence, which lasted throughout 2020. Based on that, we selected 6 CMOs. In the end, as you heard, we work with 5. We were unfortunately also during our efforts, we had to apply one backup scenario with one of the CDMOs, and it started in 2021 after some not very work which was not progressing with one of the CDMOs. There was 90 molecules, as you can see, 108 market authorizations, in total 100 batches performed, including the demo batches, and as the hosting site was also closed, the number of the people from the hosting site and then our ISO team, receiving team, so the number of the people involved, it was around 35. What I liked yesterday during the roundtable discussion and actually speaking about the tech transfer is that some of the colleagues said that you can recognize the person who is dealing with the tech transfer just by chatting one minute and exchanging some of the experiences. So yes, anyone involved in the tech transfer, probably some of these things would not be very novel, but let's say the starting point is obviously the CDMO. We could not find one perfect CDMO for the job. One thing was the volume. The second thing was that we really had different technologies. We had simple solutions, solutions which were high viscosity solutions. We had preservative-free formulation, preservative formulation, suspensions. So honestly, we did not find anyone who could do all that job in one place. Then let's say we could not connect the lines for the medical devices with the medicine products. And as you can imagine, in this period of time, 2019, 2024, these companies are also changing, right? So the capacity or whatever the capabilities we checked in 2019, 2020, they were obviously not the same when we were launching in 2024, 2025. So that obviously needed the special monitoring. Culture thing, I would say, sounds obvious, but also CDMOs are quite different in the way they are working in a different part of the cycle of the tech transfer, right? So some of them were really proficient in a tech transfer. There was a really strong project team with the support, bottom-up way of working, but some of them and then lacking some competences in a commercial phase or in launching, and some of them completely opposite way. Some of them were also the kind of central decisions taken, and one of my favorite examples, like today still CEO managing serialization issues for us with this product. So quite different approach with different CDMOs, but this makes the work quite different. Then in a tech transfer, actually in this slide, I could spend really hours saying what was happening. But my favorite one is because sometimes it appears the phrase one-to-one tech transfer, right? So honestly, I've never experienced that. So even if we found a really perfect technological fit, there are some tweaks, there are some adjustments, there are things which you need to do. And let's say why I'm mentioning bottles, because we were using 3 different type of bottles, and then before the transfer, you are asking yourself, okay, shall I use my bottle which is designed for that formulation, and then buy the tooling for my bottles, wait for the capex to be realized, and then, let's say, to help my product to use my bottles, or shall I adjust to the equipment which is within the CDMO, and then adjust somehow my formulation to their side? So I have to say, fortunately, we went with our bottles and with our experience, and actually the only failure we've got actually when we used the bottles which were not originally used with that product. Then I think we've been with this process, we've been privileged with the new MDR regulation. It was quite a struggle. Nobody could advise us, let's say, how to follow. So we were testing the water and approving the product while these regulations actually were coming into force. Regular EU GMP, but also the markets we were working with were the Eurasian GMP. What actually, later on, I will also mention it, let's say, as you can imagine, when you are moving the whole portfolio and you are preparing, let's say, with the 5 different CDMOs, so things are essentially happening in 5 places at the same time. And you can imagine that preparing the validation documentation, regulatory documentation was also happening at the same time. So that was also quite a big challenge for us with our CDMOs. The time, obviously, the prerequisite to that transfer was obviously to building the inventory, the certain inventory of that product with a certain shelf life, and also adjusting then the launching scenario to the inventory and the shelf life which was expiring. And as you remember, during that time, I mentioned 2019, 2024, we had quite some geopolitical challenges as well, COVID, full-scale war in Ukraine, so across our border. It made our life a bit difficult, definitely in terms of lead times, speaking of which, during the process, the lead time for one of the bottle suppliers rise from even to 18 months, right? So imagine how much in ahead you need to plan the transfer and the launching activities with these things. And I would not be in the procurement, or we would not be conscious project team if we would not save some money, let's say, on some activities, because as you can imagine, this transfer cost a bit of a fortune, let's say, with our CDMOs. Then why we believe that running this as a series of projects did not fit our purpose. We ran it really as a program because we were moving whole portfolio, not just as single products. The other thing, its program is about the business change, right? So essentially, we had in-house manufacturing, and then we have these 5 CDMOs. So we were counting the success based on the when and how we are able to serve the patients and the market with the product from the other place. In a project environment, we are used to have things under control. We don't want too many changes. Where in program, it's actually we are welcoming all of these opportunities, adjustments, reprioritizing the project. So the milestone is somehow was not the gut of this initiative. So the success was related with the supplying the product on the market. Then obviously what we were discussing here these last 2 days also quite a lot. It also sets you up your relationship with CDMOs. It's not transactional, it's more strategic. You are openly discussing what are your needs. That's simply you are giving up your babies, let's say, to raise them simply with someone else. Then how we actually do it. So with program was a certain governance, let's say internally, but also externally. We had obviously steer costs with our top management. We had steer costs with our suppliers. But the key thing which I wanted to share with you is that actually we build the transfers in a kind of waves. So let's say the setup was obviously based on the commercial and the patient needs first, but then also it was adjusted to the technology platform, API families, and the things technologically we could learn step by step with the CDMO. So every step, like stepping up the steps in a hotel, we were learning every steps and using this leverage and this know-how from the every steps we were applying with other products. That, let's say, allowed us sometimes, let's say, to make quite few demo batches, let's say, with one product, but then probably save some time with the other product. We were also not jumping, let's say, without the trials, so we were not assuming that the things will work from the day one. The another important factor is, I mentioned about the team, trust your MS&T. Let's say, without them knowing these products, they were, during the due diligence, I still remember, they were tracking every pipe, the length of the pipe, really everything. You need to trust them, you need to ask them the questions and really take that into consideration, but also based on that all information and the technology fit, you need to build the mitigations and the fallback scenarios and really be ready to implement them when it's needed. Okay, so what actually worked very well? So this risk which was built in, it was essential part. It obviously started with the technical knowledge of the team. Also. You need to start step by step with the optimization, validation, and then the scale up. And we believe that this program level helped us to make it through. What actually didn't work? We were so much focused on the technological part and the technical part fit of these CDMOs that somehow we overlooked or did not pay enough attention to the analytical part of the job. Because when you are doing the extensive demo batching, then when you are mixing the scenarios and somehow reprioritizing, it happens that you need the results really in a short time, and there are peaks in a lab, but there are peaks also within your validation teams. There are peaks in your regulatory team that they are not able to handle so many tests, so many documentation at the same time, and that brought us a bit of troubles in the timeline. We somehow launched some documentation that were prepared by the CDMOs, not only by us, some external companies, but this is something we could improve. Then probably we should, let's say, be more prepared for the Annex 1 changes and the MDR changes. Probably we should more ask for the external help or to include these regulatory bodies earlier with our job to explain them what we are doing. But let's say the unfortunate was that unfortunately we were running under these new regulations during that time. What actually I mentioned that these fallback options were very important for us, but what is even more important having the fallbacks is where to start them, right? Because when you are in the process of doing things during the transfer, you tend to somehow to dig in. Maybe this CDMO will work better, or maybe I'm able to resolve the issues with the batch better. Maybe I can improve the formulation. Maybe I can do still something with the bottles. But then you need a certain decision point that, okay, it's enough, and I need to apply the fallback scenario already, because if not, the overall process would be late. So that's a slide shot of pros and cons, and then the key takeaways for you as a summary. So, as said in the beginning, let's say it was not an exercise to optimize portfolio, simply to serve the market and the patient in the right way after closing the site. We believe that in such complex scenarios, you need to run the project as a program, as a business change. If more logic you can apply to it and learning scenarios for you, the better. Don't jump into the validation, because on paper it looks that you are saving time, but then when things are going sideways, you need to simply repeat it. Have fallback options for, let's say, do the really before the project, do the risk analysis from all of the standpoint, technical, technological, and the project-wise, and have the fallback options ready, and be mindful where to implement them. And also look really at the all angles and the peaks which might happen during the process, to make sure that you have the right resources all the time, also during the peak times. Coming back a bit to the beginning, as said, these people, Piotr, Ania, Jacek, Gosia, Kasia, Daniela, and Andrzej, you have here in the audience. Happy to have them with me. Let's say somebody could ask if I would repeat this project again, or similar project again. Initially, I would say no, but with this team, yes. That's more or less the story of a tech transfer. If you have any questions, feel free to ask. Thank you.
Brilliant. Thank you.